Welcome to our presentation on complete blood count CBC interpretation. My name is Dr. Rabab Salama, and today I'm going to explore how to interpret CBC. At the end of this session, you should understand the components of CBC, learn how to interpret white blood cell count, red blood cell counts, and platelet counts, and apply knowledge through a case study. A CBC is a fundamental test in hematology, providing critical information about a patient's health. A CBC measures several components of blood, including red blood cells, white blood cells, hemoglobin, hematocrit, and platelets. Let's ask a question. Name a condition that might be detected through a CBC. Yes, well done. Anemia, infection, and so on. Let's narrow and focus to three key components: white blood cell count, red blood cell count, and platelet count. Which of these components do you think is most critical for diagnosing infections? Well done. The white blood cells count, as it helps identify infections and immune system disorders. As regards white blood cell count, normal ranges from 4 to 11,000 cells per microliter. The high white blood cell count indicates leukocytosis, which is caused by infection, inflammation, or leukemia. Symptoms may be fever, chills, or body aches, while the low white blood cell count indicates leukemia caused by bone marrow disorders, autoimmune disorders, or severe infections. Symptoms are frequent infections and fatigue. Regarding red blood cell count, the normal range is from 4.7 to 6.1 million cells per microliter for men and 4.2 to 5.4 million cells per microliter for women. The low red blood cell count indicates anemia caused by iron deficiency, chronic disease, or bone marrow implants or other causes. Symptoms are fatigue, weakness, and pallor, while the high red blood cell count indicates polycythemia caused by dehydration, smoking, or high altitude. Symptoms are headache, dizziness, increased risk of blood clots. Lastly, regarding platelet count, normal range from 150 to 450,000 platelets per microliter. The low platelet count indicates thrombocytopenia caused by leukemia, viral infections, medications, or other causes. Symptoms are easy bruising, prolonged bleeding, or fatigue, while the high platelet count indicates thrombocytosis caused by bone marrow disorders or inflammation. Symptoms are headache, dizziness, or increased risk of blood clots. Let's apply what we have learned on a case study. A 45-year-old female presents with fatigue and pallor. Her CBC results shows RBCs count 3.8 million cells per microliter, hemoglobin 10 gram per deciliter, and her MCV was 70 femtoliter. Based on the CBC result, what could be the possible diagnosis? Investigate the underlying cause of anemia, such as iron deficiency, and initiate appropriate treatment. That might include iron supplements, dietary changes, or further tests to identify chronic disease. Let's discuss another case. A 30-year-old male presents with fever and sore throat. His CBC shows white blood cell count 15,000 cells per microliter, and the neutrophils was 80%. What is the most likely cause of the elevated white blood cell count? You have three answers: viral infections, bacterial infection, or allergic reaction. Think well before answering. Yes, increase the percentage of neutrophils or the relative count of neutrophils, suggesting bacterial infection. Well done. CBC results can guide further diagnostic testing and treatment plans. For example, a high white blood cell count might prompt additional tests to identify the cause of infection or inflammation. Let's ask a question. What additional tests might you order if a patient has a high white blood cell count? Well done. Blood cultures could be asked to identify infections and imaging studies to locate source of inflammation. In summary, interpreting CBC results is crucial for diagnosing and managing various medical conditions. Understanding the normal ranges and potential causes of abnormal results can help guide effective treatment. Thank you.